Knock, knock. Hi, Mr. Kendall. My name is Heidi. I am a student nurse from WKCTC. I'm here to do your head to toe physical assessment. This should only take a few minutes and it shouldn't hurt, okay?
Okay.
I've just performed hand hygiene. I have shut the door and provided for privacy. What's your name?
Brady Kendall,
And your date of birth?
7572,
And where are we at?
Paducah, Kentucky.
And why are we here?
Head to toe assessment.
Patient is alert oriented times 4. Can you squeeze my, no. What is your name?
Brady Kendall,
And your date of birth?
7572.
Good job. Can you squeeze my fingers for me? Grips are even, equal bilaterally. Now look at your eyes, okay? Pupils are even, equal, reactant to light, and accommodation 2+. I'm moving on to my respiratory assessment. The chest is even in color and consistent with the rest of the body. Chest is symmetrical. There's no masses. No masses or abnormal movements noted. Going to check my respiratory rate. Respiratory rate is 18, normal, within normal range, unlabored. I am going to palpate. There's no tenderness noted. Patient is not grimacing or wincing. There's no masses or bulges felt. There's nothing that moves whenever I palpate the chest. I'm going to palpate your capillary refills. Capillary refills within 3 seconds, which is within normal range. I'm going to listen to your breath sounds. Doing 8 breath sounds anterior, 5 breath sounds interior. Eight breath sounds posterior. Breath sounds are clear, unlabored, even on both sides. I am going to move on to my cardiac assessment. I am inspecting the precordial areas for pulsations. I'm checking for jugular vein distension. There's no JVD noted. I am inspecting. I'm inspecting my precordial areas, which are the aorta, which is 2 intercostal spaces on the right, pulmonic, aorta, 2 intercostal spaces on the right, pulmonic, through 2 intercostal spaces on the left, Erb's point, 3 intercostal spaces on the left, tricuspid, 4 intercostal spaces on the left, and the mitral, which is 5 intercostal spaces mid-clavicular line. I am going to palpate the precordial areas. I feel no pulsations in the precordial areas. I'm going to auscultate my precordial areas using my diaphragm, aorta, pulmonic, Erb's point, tricuspid, mitral. I'm now going to listen to the apical pulse for 30 seconds. Apical pulse is regular. If I heard any irregularities, I would listen for 1 minute. I am now going to listen to my precordial area. I'm listening to the carotid artery for bruits. There are no bruits noted. I am moving on to the peripheral vascular area. The peripheral vascular area is consistent in color with the rest of the body. There is no edema noted. I am going to palpate my points of maximum impulse, which are my carotid arteries. These are done singularly and not bilaterally. My brachial, radial, femoral, popliteal, dorsalis pedis, and the posterior tibial. Points of maximum impulse are even bilaterally. I am going to move on to my abdominal inspection. The color is consistent with the rest of the body. It is symmetrical. The shape is flat. There are no protrusions, no abnormalities seen. I am going to listen to the abdomen with my bell. Left lower quadrant, left upper quadrant, right upper quadrant, right lower quadrant. There are bowel sounds noted in all 4 quadrants. I'm going to listen with my bell. I listened with my diaphragm for bowel sounds. I'm now listening with my bell for bruits, aorta, renal, iliac, femoral. There are no bruits noted. I'm palpating the abdomen, left lower quadrant, left upper quadrant, right upper quadrant, right lower quadrant. There is no tenderness noted. There is no rebound tenderness noted. I am going to remove my gloves, lower the bed, remove the bed rails, place the call light, document my findings, report any abnormalities to my charge nurse, and wash my hands.